My journey is a little bit unique. I started as a pharmacy technician in Northern Illinois and aspiring to go to pharmacy school. And I started working for Walgreens. And as I was working for Walgreens, I did get accepted to UIC. Worked as a student all through my student curriculum at UIC. And then upon graduation, I did move to Springfield, Illinois. Started working as a staff pharmacist and was fortunate to do that for a couple years, as well as get some unique experiences with diabetes education. I was one of the first immunizers for Walgreens, one of 6 of us that had the immunization certification at the time in that area, so everyone was getting flu shots from us, and it was pretty fun. Then I had the unique opportunity to be a pharmacy manager at a new store that opened, and then a couple years later an RMGO, which is a specialty pharmacist, clinic manager at a health system pharmacy in Springfield, Illinois. And then since then I had 37 pharmacies that I oversaw, more of an operations and clinical support role, and then our company restructured and came up with a new role called healthcare supervisor. And in that role, it was more of a blend between that clinical education and coaching and support of the pharmacies and the initiatives that we had, but also a blend with working in the community with organizations, health system partners, and government relations, board of pharmacy. Most recently, our company recognized the need for change from the healthcare standpoint of how rapidly specialty pharmacy was expanding. And I was fortunate to be able to take on the role of the healthcare specialty supervisor. And so now I have 12 specialty pharmacies and pharmacy managers at those sites that I work with and support, get to coach and educate those very talented individuals, and as they take care of various specialty disease states, oncology, transplant, HIV, rheumatoid arthritis, MS, so it's a lot of fun. I think my most current role, I feel like I get to coach and educate an already very smart and talented group of people on how they fit into what's changing in healthcare and how it's rapidly expanding from the adherence standpoint, the pay for performance, how important the pharmacist role is to quality from the standpoint of Medicare, STARS measures, the way the health system partners look at the pharmacist role and how key we are in that puzzle for them. So I feel like just by making that connection and asking those types of questions about where they see their career going or where they see their care for their patients going, I feel like that helps really ensure that they're operating at the top of their license. I've had a lot of fun the last few roles I've had, but they've all been fun because they're challenging. I think the healthcare industry and certainly the pharmacy role changes very rapidly, and what's important is not always important when you wake up the next day. So it really just is kind of a challenge to stay on top of what's happening and being the best support you can in that leadership capacity. And I would say that working with a variety of different pharmacists, there's more than one type of leader, and there's more than one type of motivating factor for those individuals. So I would say probably the most rewarding and the most challenging thing about what I do is working with the people, because you just don't know until you get to know them what's driving them and how to get the best out of that person. I've had so many people support me, encourage me. I would say my family, my husband, certainly my little kids, even though they are 6 and 3, my parents, teachers, professors, good leaders, good supervisors, friends have all been encouraging and have helped me to get to where I am. But I would say that maybe the more inspiring group of individuals are the ones that thought I couldn't do it, or would challenge me and say, that's maybe you should explore something else. I had a couple of people that come to mind that I've run into throughout the course of my career that would say, well, I just think maybe you should explore something else, or I think this is going to be a challenge for you to do this, and I think that just motivates me to try much harder, and I think that's probably why I'm where I'm at, and feel like some of what I do is pretty successful. So if I were going to go back and talk to myself when I was a P1, I would tell her to get more involved in organizations, volunteer, be part of the clubs. I loved pharmacy school, but I did not take advantage of the opportunities that I could have. And I think as I think back and I think about where I'm at now, and what I do is all about relationships and networking and connecting with people in various different capacities, I could have expedited my success and saved myself a lot of heartache if I had maybe just gotten a little bit more involved a little earlier and made those connections while I was in school. So in 10 years from now, what I hope to see is the continued growth and acceleration of what we do as clinicians, and how we show up as a partner to our interprofessional relationships with physicians and nurses, and what we see in specialty pharmacies and those on-site relationships where they're there in the hospital, we're seen as a key piece to what that patient's experience is going to look like. And I think we have the ability and potential structure to do that. I do hope that over the next 10 years, 5 to 10 years, we find a way to make that a possibility so that we can really be rewarded.